My name is Patrick, and this is my respiratory assessment. I'm first observing for chest rise and fall for a full minute in a clinical setting. The adult ranges are 12 to 20, and I'm also observing the entire color of the patient. My patient looks pink, which is a normal finding for her. I'm usually looking for pallor and cyanosis, signs of pallor and cyanosis, and there's none found. I'm also looking for the engagement of the accessory muscles, the sternocleidomastoid in the side here, the abdominal, and then the intercostal muscles. There's none engaged here. I'm listening for audible sounds such as wheezing, stridor, and grunting, and I do not hear any of that. I'm also going to go ahead and look at the shape of the chest. I notice that the anterior posterior diameter is approximately half of the lateral diameter, which is a normal finding. I'm also observing for any structural deformities like barrel chest, scoliosis. I do not find any, both anteriorly and then also here in the posterior side. I'm also looking out for any symmetry. I notice that there's bilateral chest expansion, which is equal and symmetrical on the anterior. Also, the posterior chest expansion bilaterally is equal and symmetrical. I'm also looking at the suprasternal and substernal muscle engagement for any retractions. There's none observed. As far as chest expansion goes, there's no restrictions. There's no impaired movement that I can observe. I'm going to go ahead and auscultate in a ladder form for any adventitious sounds. Go ahead and take in a deep breath for me. All long sounds are clear throughout. Go ahead and also say E, E, E for me, okay?
E, 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 E.
So I hear a muffled E, which is a normal finding. A nasal E will be an indication of consolidation. I'm also going to go ahead and palpate for tenderness. So let me know if there's any pain, okay? Do you have any pain?
No.
Any pain? Any pain? I'm also observing for any pain? Any pain? Any pain? I'm observing for any deformities, skin deformities. There's none observed, both interiorly and posteriorly. Go ahead and take in a deep breath for me. Good. And a deep breath. Good. So thumb expansion is bilaterally equal and symmetrical, which is a normal finding. I'm going to go ahead and have you say 99, 99, okay?
99, 99, 99.
Okay.
99, 99, 99.
All right. So there is normal tactile or fremitus throughout. I'm going to go ahead and percuss. So percussion is resonant with no dullness. Thank you.